here this morning with my handsome client, and we are going to have nasal surgery. So, are you nervous?
A little bit, yeah.
That's very normal the morning of, and we've had so much preparation leading into surgery, including a CAT scan to look at the internal anatomy, because I really believe in getting people breathing better, making sinuses drain correctly, in additional to like the aesthetic aspect of surgery. So we had a pre-op discussion. You have your loved one here.
Got the whole team here.
The whole team is here, and we've had tons of photographs. So I'm really happy that you decided to help us document your experience today. So what are your goals with your nose?
Definitely be able to breathe better, sleep better, not have a crooked nose.
You're so handsome. Has anybody even noticed that? Does anybody notice that?
Thank you. But I mean, yeah, those are my three. Those are top three right there.
Yeah,
goals.
Zoom in a little, Emily. Let's take a look at his nose. So, looking at his nose, like overall, he does have a little prominence of his nasal hump here. His tip comes down just slightly, and I'm looking at like really fine details. When I see this overall view, obviously we don't really notice anything other than great looking guy. But I can imagine if you're the person that has this nose that it bothers you a little bit. In photographs that you see it off to the side, not exactly perfectly straight, right? Mm-hmm. Did you break it?
I mean,
broken for you?
Yeah, I don't remember like a traumatic moment where it was broken, but I mean, I played sports my whole life growing up, so I think I may have gotten smashed in the face with a ball a couple times or something, but not a break that I can remember.
That you remember,
though, yeah.
And that's so common with patients, but I can definitely see where there's a little asymmetry and depression of the nasal dorsal bone right here, a little tweaking to that side. So my goal with surgery today is to straighten that, to bring the hump down and bring the tip up, and just kind of make your nose go away. Like that should not be anything anyone notices about you. It should just look exactly symmetric and proportional, and they should really just focus on your eyes and your smile. How do you think his nose has impacted him over the years? You guys been together how long?
About 3 years.
Yeah.
And he snores a little bit at night. So that, besides that, I think in pictures and photographs as a model and actor, it's something that impacts him cosmetically.
Yeah.
I think something really cool as an ENT that you get to do is not only are you doing surgery to help something medically, but also it's more of an art and a cosmetic. So it's pretty exciting to see the results.
Yeah. Well, do you think it's going to boost that confidence?
I hope so.
Yeah. I mean, we all have those little naggy things that eat at your self-esteem just a little, so it's nice to be able to knock that out of the park. So surgery will take a couple hours, and when you wake up, there'll be a cast, there'll be some packing, little bitty mini tampons, and then that's the only thing. And tonight you'll feel a little stuffy-headed, but mostly no pain because we'll use a nice long-acting anesthetic shot, and we'll see you in the morning. You're going to do lots of ice and minimal bruising. Patients do bruise some with the surgery because we're resetting the bones, but it's definitely worth it for the long haul.
Cool.
So, all right, do you want to give him a good hug for good luck?
Crush
Don't worry,
it.
I'll take great care of you. Okay. I find my day where it's like my Zen moment. Scrubbing into surgery is a little bit of meditation and focus that goes into this process of like gathering your game plan, knowing what you want to do for the patient, and just putting all other extrinsic thoughts out of your mind. So I love that about surgery, that it's like hyper reality, super focused and very intense. And I love being able to see a problem and fix it and give my patient a great result. So that's sort of the mindset that I take a minute and concentrate, focus, put all of my positive energy into getting a great result. like I hit him with the good right hook, huh? How was surgery yesterday?
Painless as far as I know.
Yeah, I heard you didn't take any pain pills last night.
Yeah, no, I didn't. I actually don't feel like I'm in pain right now at all. The only thing that I didn't like was the packing in my nose.
Yeah, we had one night of packing with 2 little pads in there, and we just took those out, so I think that probably feels amazing to
Yeah.
not have any pressure.
Yeah, way better.
Yeah, so he's definitely bruised. This is something you can expect after rhinoplasty surgery, to have bruising and swelling. And that's really because we reset the outer bones. Patients that are just doing their tip work don't necessarily have all that, or internal work, you don't have all that. But the cast is going to protect the bones. You're going to see the transition day to day. You're really going to feel much better. Today's
Yeah.
the hard day. It's right after surgery, but everything gets better and better.
Yeah, that's what I keep telling myself.
Yeah, so this drip pad will take off later today. He's going to start doing some saltwater sinus rinses. And other than that, your job is to go home, Netflix, and chill, literally. Like, chill, put some ice on there. Not the other definition. But ice pack, lots of arnica, good, healthy nutrition, vitamins. And,
For sure.
And time, mainly time.
Yeah.
All right. Well,
All right.
thanks for journaling with
Yeah,
us,
of course.
showing people this really life-changing journey that you're going to do.
Yep.
And
Thank
your
you.
nose was so crooked inside, by the way. I don't know who punched you or who hit that nose,
Yeah.
but it was so deviated, and literally your sinuses did not drain well. So I took out some fair number of polyps from the sinuses around your eyes. So that's something I love to do for patients. I don't want to just fix the pretty. I also want you to breathe right, and have your sinuses drain right, and have a great sense of smell, and just like functionally be great.
Yeah.
So good.
Okay, today we are seeing Justin back. It's post-op day 7, and he's had nasal surgery, rhinoplasty, as well as some sinus surgery and deviated septum work. So, are you breathing okay? thus
Yeah,
far?
yeah, I'm breathing better. I can feel air in both nostrils.
Oh,
That's
good.
that's the first.
That's encouraging, because
Yeah.
this first week you actually feel quite stuffy, almost like you have a cold.
Yeah, yesterday was the first time walking the dog outside. I was like breathing out of my nose and feeling it, 'cause it's a little
Okay.
colder at nighttime, but I could like feel actually air coming in both nostrils.
Well, good. Your nose is
Yeah.
going to breathe better than ever. Today we took off his cast. You can see he's still a little bruisey. There's a little bit of blood vessels there in the eye area. That's all kind of very normal, but most of that will be 100% gone at around 3 weeks. 80% of the swelling that he has here in the tip will be gone. But today he's swollen. We took out stitches, removed the cast. You're going to feel much better. Good. Are you feeling a ton of pain? Because people worry, they're nervous about surgery. They think, oh, it's going to hurt.
No, I wouldn't say pain. There's a few discomfort, things. But I haven't taken any pain medicine at all, actually. I haven't been in pain, just a little bit discomfort.
Yeah, I feel a little, mostly stuffiness and just feeling a little pressurized, I
Yeah.
think, mainly, right?
Mhm.
Well, good. You're a great patient and you're following all the instructions, so we will keep you posted on our results. We'll see him back at again. So we see him post-op day 1, today's post-op day 7, and we're going to check back at about 3 weeks. Okay?
Cool, sounds good.